Assalamu alaikum. At the beginning, I am very happy being with you here at this summit to talk about our experience and Dubai Health, also about the knowledge also. There is no doubt that the knowledge is the future way, as we hear that also by many speakers. So we reach it by the knowledge also that with the space, we reached the space and Mars and so on, also now leading many indicators, international indicators, and we are very proud being in the United Arab Emirates and that we are also the sons of this nation and the sons of Zayed. When we talk about also health, this is one, or this is it's the most sector affected by the knowledge, because without knowledge also we are not going to have development, and no improvement is going to be there in such a sector. And so the treatment we had 50 years ago is going to be also, it might be prohibited right now to have it in the health sector. So the aspects of my presentation, it's going to be about the vision, mission, and values, and we are going to see how knowledge is embodied in health sector or Dubai Health, and we are going to talk about the digital health and how important this is. We are going to talk about the adoption of new values on the health care, and how we design the digital health. And also, what about the services or the distance services through the experiences or the experiments applied by Dubai Health? So the vision, mission, and values of Dubai Health. It's Dubai, the leadership or the nation of the leadership, and we are not going to have leadership without innovation, without being in harmony or going in harmony with the updates in the health sector. Our mission also, Dubai to be one of the leading cities, also providing health, and we have to make sure that the residents of the city getting the health care also in a very low cost, and we have to enhance the innovation and the research. I have been asked a few minutes back about the research. We are not going to have development or improvement without a research, and the research leads to innovation. Innovation leads to integrated health services without mistakes or a very few mistakes. Values and the human being, we have transparency and innovation. So innovation is one of our values at Dubai Health. So the aspects of the vision is also, we have four, and the contribution of the economic or the economy of the emirate also. So we have it here. The innovation is one of the aspects or the pillars of the values and vision and mission also of Dubai. So our priorities or our strategic priorities, we have to transform, and we have to take care of the education and the health care. These are very important priorities for, and in regards to innovation, as we do our best also to transfer our health centers, not just those belonging to the public sector, but anyone working in the healthcare, to transform these centers also to digital centers. And we urge people also, to take care of the research and the healthcare. And Dubai Health is very committed to develop the health sector, totally the private and the public sector. And we have continuous education programs taking the innovation and the digitalization as a basis for that. Also, the most common diagrams or we have right now, or the terms we have, it's maybe the digital or the electronic health as defined by the World Health Organization. As you know, all the definition. This is the official, or I mean international term we have. What does it mean? It's a term, a very integrated or comprehensive one, covering all the digital aspects in addition to the emerging sectors, like also using the computer and using the big data, genoscience, and many other sciences also. So you can't be improved right now, you can't develop yourself, you can't go in harmony with the modern sciences and unless you have a very suitable infrastructure of the health. And you can do that also without having the modern tech tools, and you can't be improved without having skilled manpower in this sector to work with the technology you have. So it's very important. So the importance of the digital health might lead to the health of the human being, to reduce the human mistakes, because as much as we use the technology and the right ones, also I'm talking about the right technology, also that which leads to the less human mistakes also, I mean, and the proficiency, efficiency of the services also, I mean, as long as they are relied or based on the technology, that means we are going to reduce, or I mean, you are going to increase the quality of the service, and you are going to serve people faster, better, and so on. And because we need to provide the treatment based on the needs of the patients, based also on the digital analysis, also, as we are going to see very soon. So the elements that support the innovative health services. So we have models of that. It's very important or very necessary through the technology innovation. We have to support that. It's not enough to just call the employees to be aware of the technology, modern technology, but as an institution taking care of the health, and we are very concerned about that. We are take care of the legalization and supervision, and we have to motivate having the best service providers. Therefore, also we have to encourage the investment in the technology, also either from the private or the public sector, and also the artificial intelligence and the big data, because we in Dubai Health, we are there to know what are the capabilities, what are our capabilities, and how we can invest in that. So we had a survey about also the emerging technology and the modern technology, and which resulted in a very big list. Every employee has experience in more than one technology. Those are the pillars. Those are the pillars of our future. So we are going to train them intensively to make the best use of them. So to use the technology, the digital technology, and to develop the health sector. Cooperation with the universities and educational institutions are having comprehensive research of the digital health. I should make cooperation with these universities and institutions to know how to develop the employees' capabilities and to attract the new knowledge and to practice the new researches, or through the cooperation with the researchers, those working in Dubai. Building the capabilities. Also, we have to qualify, train those we discover that they have the ambition and they have the skills. We have to improve such skills by training them, by having the conference or hosting the conference, international conferences, which you see also in the United Arab Emirates. These are new sciences, new technology, and the exhibitions hosted by the United Arab Emirates, because they are bringing the updated technology. So I send my people to such conferences, or either I send them outside or to the international centers to learn, be trained, and to have an idea about the updated technology. Licensing of comprehensive health services. We have to be resilient, we have to be flexible, and to accept the new people and to license them after making sure of the safety and so on, and the international recognition of the use of the modern technology in the health sector, which we didn't use it earlier. But right now, for example, also there are new treatments, and which at the beginning we asked some authorities earlier to know about this one. But once we made sure also, okay, that they have that, also we needed to support them and to deliver that to the patients. And we have to evaluate and follow up the performance of these technologies, and to make sure they are there and they go in harmony with the new technology and so on. And we have to make sure that the society is very happy with that. And we have to listen to the community, because the community 30 years before, any service providing to the society, also it was accepting that, because they were accepting the very primary or very basic services, because these were the expectations of the society. But right now the patient, or it might be from a very a very developed country, or it might be he has been traveling outside, and therefore also he is aware of the new tech. Therefore he is requesting such equipment to be in the United Arab Emirates. So we need to listen to those people to develop the services based on the society's expectations. Also to have digital health based on the human being, because we can't provide that without having the human being at our center. We have to do that, and we have to speak to our patients, and we have to understand the requirements and from the digital health systems. Ron Hoffman, this is the speaker of the customer service. Also, he has a very good definition of about the service providing. You have to fly over rising the expectations also, because the expectations of the customers also are raised, or are getting up and up, because if you are providing a fixed level of the service, also you are not going to achieve the happiness. Therefore you have to go in harmony with the scientific development and to provide the service based on that. You have to fly over rising expectation, because you have to be one step before and one step ahead. How to do that? This can't be achieved without being aware of what's happening in the world, and trying to attract people, and having your people involved in the conferences of the high tech, and having a good idea about that. To ease the use. Also, once you apply some new tech, also it should be humanized. It should be very simple, not complicated, because people have different levels of understanding. Therefore, to go in harmony with that, it should be very easy, simple, according the people understanding levels. Safety and privacy. The person or the user or the person applying where the technology is applied on, he should feel safe and private and about that, because I can't accelerate the service, and after that also my information or my data are common, or I might have some damages on my health. And also we have to have the people involved, though the service takers, they should be involved, and they might have previous experiences. I should learn about these services, and I should make use of that, because such bad experiences I might avoid, and we have to have the digital services. And also the feedback response also, once I provide the service, I should listen to the people. I should know about their feedback, their reviews. Do they feel happy with this service, or about this technology, or how do they feel, if they have any comments or so on. So getting in harmony or getting adapted to the changes, because the services provided by us also, we should go in harmony with what we have, because I can't use the updated, or the old dated one or backdated services right now, and we have to have integration between the digital technology systems, and they should not have conflict between the systems. Sometimes we have such a conflict which leads to not providing the community with the needed services. Now let's talk about the experiences or the experiments of Dubai Health in regards to providing the digital health services. And one of the most important one also during COVID-19, which we wish we're not having it back also, a doctor for each patient also. In COVID-19, we were very keen about the old patients and people of chronic diseases also, to visit the centers, to come to revise us or so on. So we instead of having them to the health centers, also they can just contact the doctors digitally through a doctor for each patient. This is and he can ask the doctor, or the patient can ask, and he can prescribe him the medicine without coming to the hospital, because we wanted to make sure also he is safe. Such an experiment or experience also has been developed until we have the initiative with the Ministry of Foreign Affairs. Now any Emirati living outside the country, he can, in cooperation with the Ministry of Foreign Affairs, can have a contact with his doctor through such a digital service. He can talk to the doctor about his need of the medicine, about also the development of his medical case, or medical states and so on, and he can help him in that. Using the AI and in providing the physiotherapy. 3D printers also for the earlier we used to have also the artificial parts of the human bodies. We used to have them also, but right now we have these replacements also for those patients who need that. Very high quality and a very short time. This is also one of the new technologies, or one of the new innovations we have, and this helps a lot, and which accelerates the procedure instead of waiting so many hours or minutes. So such systems, such a new system or technology can provide the patient with what they need. So using the AI and eye diagnosis. AI. We don't need also the prescription or the analysis of the doctor. Just, the AI can look at the eyes of the patient and can determine if there is some changes in his eye, because and or can give a report that this one is stable, that this patient is stable, and or there are some delay in his cornea. So to avoid the human mistake and can accelerate that to determine what's needed, if he needs also some treatment for his eyes or so on. So artificial intelligence is now providing such diagnosis, using the emerging technology to contact the patients and just providing them also with the prescription, because after having the prescription and having the medicine, so you get a contact or a call explaining for you the medicine used, if there is some changes in the name of the manufacturer, or sometimes also you have some medicine and it's the same medicine but from another manufacturer, from another company, another factory. Also some people think also it has been changed, but no, the policy of the health authority is changing the supplier. So we give you a call to introduce you to the new product and give you an idea to prescribe the way of use on how to use it, and such a medicine, and what's prohibited in the use. Also today, to reduce the rate of the mistakes, medical mistakes, also some our institutions use, either the private or the public one. Also we use also the smart pharmacies. So the doctor, can make the prescription on the internet, or and after that it goes directly to the pharmacy. So there is no intervention of the pharmacist in having also the smart pharmacy just responding to the prescription prescribed by the doctor. So if there is a contradiction between the medicines, so the device itself is going to stop the release of the medicine. So it's a very so the smart pharmacies is a very good advantage as accelerating the distribution of the medicine and reducing the medical mistakes, and also avoiding the contradiction of the medicines. Also, the robot surgeries also, in the hospitals. Right now, also the robot treatment is reducing the mistakes and accelerating the recovery. And I had actually also an interview a few minutes back, and I can remember I myself in 2001 I was in Boston in the United States of America, and I was in Mass General Hospital. I have seen a surgeon carrying out also a cardiology surgery also by robots. I thought also the doctor is in one room and the patient in another room. I went to the second room to look for the patient. I asked, where is the patient? He said he is in Jeddah, Saudi. That was in 2001. Where was the technology at that time? That means also the technology has been developed a lot. That means the patient was in Jeddah and the doctor was in Boston, the United States, so 1,000 of miles in between them. But so instead of leaving his patients in the USA and coming to Jeddah, KSA, spending some money or some time, now he can do it through the modern tech. He can carry out the surgery and for a Jeddah citizen, and that time he was very good also. I don't know now what happened with now. And I asked about him. I followed his case, and he said also, it was carried successfully. Also using the AI for updating the qualification of the doctors and so on. As you know, right now, also for the qualification or licensing, also, I mean, we should have a committee to inspect the certificates, and some of them also, I mean, they don't fulfill the requirements. But right now, also the AI, once you apply, or I mean, you send your application for the qualification inspection to carry out the medical professions in Dubai, it will show you if you are qualified or not. So it's going to isolate, or I mean to exclude those not fulfilling the requirements. At the same time, the screening of the infectious patients. When you go to, I mean, for the fitness test or something like that, also, I mean, they will take radiology and some blood tests and so on. I mean, there are thousands of people there. So if we continue in the using the old way, so people are going to wait days and so on. And so the AI can determine who needs to screening or rescreening or not, to make sure they are safe, they are fit. So they are reducing that. Also, many also don't need to wait for this. 3D printers again, I mean, to remove the cancers and so on. Sometimes also we have some cancers also in the body of the person. I mean, the diagnostic devices cannot detect that. So I mean, they can't detect the place. And so when we have the AI and connecting with the 3D printers, they will produce a sample, or they will determine the place of the such a problem, and so the surgeon will know through the robot where to reach such a cancer, or I mean to reach how to carry out the surgery and how to remove that by using the medicine or something like that. This is one of the practices carried by Dubai Health and our hospitals, and today we are talking about Dubai Health or Safe Dubai, because we, as you know, also we are supervising the services provided. But these are the services also applied by our hospitals in different levels. That's what I have in regards to the digital health practices, and I hope I gave you a good idea about that and how important they are, and how we can improve that, and how we can do it. Assalamu alaikum. Peace be upon you. If you have any questions, I'm ready for that. Yes. Assalamu alaikum. Peace be upon you. Thank you very much also for the presentation. And I am Dr. Muhammad Al-Bidar Uthman. Also, I'm enthusiastic. I mean, working at Rashid Hospital. I know too much, and how we are forecasting the future, and also looking forward to be the leader of the area. As you mentioned earlier, also, I mean, there is also a roof, I mean, of the motivation, or our thoughts, and as long as also the country is a leading country or a leading city. So, I mean, it's not a question, it's actually it's an ambition, how we make use of having so multiple nationalities here, living here We are living here in a very diverse community. We have more than 200 nationalities. Every nationality comes with its also sicknesses. I mean, and also as it comes also with the sciences, and these sicknesses also they come based on chromosomes. I mean, based on the nutrition and so on. How we can provide the humanity. I mean, if we establish an international research institute related to the diseases in Dubai, and this where we can provide the whole world with results, so we don't need to travel to these countries because they are already here in this country. And it has been proven also by COVID-19 how Dubai health is very modern, and it's very we can say it was very surprising really also. I mean, how professional we are. At the same time, I wish that to have very small practices in our hospitals. It's like the introduction of the patients into the services provided about the sectors of the hospitals. I say also because I'm working in the intensive care, how we can make the patients our ambassadors, how we can transfer them also to be ambassadors, and even their visitors also be ambassadors also for the Dubai government, because once they come to once they transfer the health knowledge or the health information, we are going to educate them what they are going to see and how they are going to treat, and what the doctor or the physician is going to provide, and so on. And at the end, we are going to thank you very much. I think there is a program for the proposals or suggestions, and so you can submit your proposal to such a program. I mean, to Dubai Health. I'm quite sure they are going to consider such a proposal into consideration if it's very, unless it's they didn't think, unless if they thought about it before, because I think we had before. This is one of the ideas also. I mean, but this can be submitted to the area, as you mentioned. This is one of the resources accredited by us, and to take the opinions of the country, or I mean, taking the opinions also of those working in the health sector. And because I don't know, you are very aware of your people more than me, because therefore it's better and for you to take care of that. Any other questions? No. Thank you very much.
اسمي شرف الدين راما، وأنا أقوم بتطوير الكثير من البحوث. أتعلم أن 70% من السكان حول العالم يؤمنون بالتطور الاقتصادي، و70% من العالم
and like collaborate the emerging economy and your institutions, as well as how this emerging economy population, especially grassroots level people, they get benefit from your research, from your innovations, and how we can make more progress through your research.
Well, the researches depends only on organization. Today, I will conduct a research based on data available. What do I face? What problems do I face in health? From where do I get this data? I get this data from the household survey, for example, which nowadays we are conducting it actually, and by end of January we will finish it actually. The result of such data will end up to decision makers to take decisions, to promote health, to promote in certain area where do we find defect in the health area, where to promote, where to increase awareness, where to invest more actually in human beings, in specialized people. So based on that, we conduct researches actually. We don't conduct researches for the sake of the research only. It is for the sake of development based on data actually available, based on facts actually. So this is how we conduct researches and how we collaborate with universities, with institutions to help us in solving problems or finding solution from elsewhere actually. Maybe, for example, in India, they faced a certain problem, health problem, which occurred here with the Indian community, for example, and we don't know how to tackle this. Maybe the researchers will do investigation to see how did India, for example, solve such a problem, or what do we need to increase awareness? What do we need to improve health sector in certain area? All this depends on the needs and demand actually. So this is how I find your question. You're welcome. Yeah, thank you.